In this segment of the anatomy, we are going to be discussing about an important component of the bone, the bone marrow. The bone marrow is a soft, loose, vascular tissue consisting of delicate network of reticular fibers and various types of cells. It is the main site of hematopoiesis. It is present in the medullary cavity of the long bones and in the cavities of the spongy bone. The types of bone marrow. Two types of bone marrow are described according to their appearance on gross examination: the red bone marrow and the yellow bone marrow. Red bone marrow. It is vascular and appears red in color due to the presence of red blood cells. It consists of network of fine reticular fibers containing blood-forming cells, showing all stages of development like immature nucleated red blood cells and mature non-nucleated red blood cells, myeloblasts, myelocytes, granulocytes, megakaryocytes, etc. At birth, it is present in all the bones at all sites and is an important site of hematopoiesis, but as the age advances, the marrow in the medullary cavity of the long bones is gradually replaced by yellow marrow. Hence, in the adults, the red marrow is found predominantly in the cancellous bones. Red bone marrow is predominantly located in the ends of the long bones, the sternum, the ribs, the skull bones, the iliac crests of the hip bones, and the vertebrae. An important clinical tidbit: bone marrow aspiration. Bone marrow aspiration is often performed by the clinicians for diagnostic purposes. The sites commonly used for bone marrow aspiration include sternum, the anterior and posterior iliac spines of the hip bones, the ribs, the lumbar spinous processes, and the upper end of the tibia. In adults, the common sites of bone marrow aspiration are manubrium of the sternum and the spinous processes of the lumbar vertebrae. In children, the common sites of the bone marrow aspiration are iliac crests of the hip bones. Yellow bone marrow. It mainly consists of adipose tissue. However, few hematopoietic elements may be found in it. Under certain conditions, such as severe bleeding or hypoxia, the yellow bone marrow converts back into red bone marrow. In the old age, sometimes the red bone marrow in the skull degenerates to produce jelly-like material or the gelatinous mass. This is known as gelatinous marrow.